Welcome to Thoughtful Thursdays. With me here is Dr. Aatif. He's a consultant urologist, and we're going to talk about the health of men in general, and we're going to explore the topic of kidney stones. Welcome, doctor.
Thank you.
Thank you for making time for us and sharing your expertise with us. What can you give us a general idea, what are kidney stones and why is it important that we talk about it?
Oh, well, kidney stones are very common in our society. If we'll go through the literature, it's around 30 to 35% prevalent in the societies. Especially in this part of the world, 60 to 70% of the people at any point in time have kidney stones. And it's a recurrent disease as well. So, according to the guidelines, 30% of the patient can build the stone again within 3 months to 6 months.
Is it dangerous to have kidney stones?
Well, if it is not treated properly and if it is ignored, yes, it can damage the kidney. And always remember that the silent stones are always more damaging to the kidney as compared to the stone which are giving you the pain.
Can you explain to us what a silent stone is? Is a normal stone making sound?
No, silent stone means that if it is present there in the body, in the kidney, but it's not giving you any pain. And this is the reason why I'm saying that the painful stone, the stone which is giving you the pain, definitely if you have pain, you will come to the doctor.
Yeah, and I think that we all know that when you have an attack of kidney stones, it's extremely painful.
Yes, it's extremely painful because it's obstructing the flow of the urine. It is stucking in the ureter at any point at any level. So definitely it is causing severe acute pain, and together with that, it's causing blood in the urine. It can cause nausea and vomiting, and sometimes if there is any infection, then it can cause fever as well.
So since you said that there are silent stones, it means that I might be having one without knowing, and then suddenly I have the pain. What should I do? And when should I think that, hey, this might be a kidney stone?
Silent stones means that if the stone is inside the kidney and it's not causing any back pressure, there is no hydronephrosis, there is no swelling in the kidney, then it is silently placed. And if it is smaller in size, yes, it can fall down into the ureter and it can obstruct and it can cause pain.
But a silent stone can become a stone which causes problems.
Yes.
Yeah, that's what I meant. So,
yeah, but
so if you suddenly have pain, what is typical of the pain which is caused by a stone?
If the stone is stuck in the ureter, it can cause pain in the kidney, and we can try to find out the location of the stone as well, that where it is stuck. Sometimes it's radiate towards the kidney area and lower down. So once the stone is propagating down, it can change its position and the pain is also changing.
And what would the hospital do if somebody comes and we think that he might have a kidney stone? What are the procedures or maybe the tests that will be done?
Well, initially, definitely, if the patient is coming to the clinic, then we have to run some tests like kidney function test to see that how the kidney is functioning. We have to do the urine test, urine routine and urine culture to see that is there any infection, is there any blood, and then we have to do the ultrasound, basic ultrasound and X-ray QB to see exactly that how much is the hydronephrosis and where exactly the stone is stuck. If ultrasound and X-ray is not able to diagnose, then we have to do the CT scan.
And in most cases, will the patient be required to stay in the hospital, or in most cases they might be able to go home again?
Well, again, it depends upon the patient to patient and situation to situation, that how bad is the stone stuck in the ureter. For example, if there is any moderate to severe hydronephrosis and patient is unable to bear the pain and there is some leakage of urine outside the kidney, then definitely he must require immediate surgery for the decompression of the system and stone removal.
And you mentioned the word hydronephrosis. Can you explain what that means?
Hydronephrosis means that there is a swelling in the kidney. because of the back pressure, because the urine is not coming out smoothly from the tube, which is bringing the urine from the kidney to the bladder. And if there is swelling, and if there is any leakage, back pressure, severe back pressure, and if there is infection, if the kidney function test is deranged, yes, then patient has to do the immediate surgery, and there are different types of surgeries. But in other scenario, if there is no severe back pressure and patient is being treated with the normal painkillers, then we can give some medications, trial of medications, so that the patient can pass the stone if the stone size is around 5 or 6 millimeter.
And if the patient has passed the stone, or if the stone has been removed, should the patient expect to get this again?
Yes, as I have told you that 30% of the patients can recur the stone within 3 to 6 months. So prevention is more important treatment, part of the treatment. So we have to do the stone test. Okay, either the patient will pass the stone or we will remove the stone. We have to send the stone test, and there are different types of stones. Around 14-15 types of stones are there. So we have to tell him the dietary advice regarding the type of the stone which he has.
So the diet is not a general diet, but it depends on the type of stone that the patient has.
True.
That is very interesting. But can you tell us a few types of diet for the most common stones? Because I think 14 is too much to discuss all
Yes.
of them. Yeah.
As I have told you that there are more than 14-15 types of stones, like calcium oxalate, monohydrate. These are all medical terminologies. I cannot tell you in.
But that's like a substance, and it
yes.
becomes like a little rock.
Little
Yeah,
rock. Yes. So there are different types like uric acid as well. So normally in our population, 75 to 80% are calcium oxalate stones, either monohydrate or dihydrate. So normally they have to avoid cabbage and cabbage-like leafy vegetables, spinach and spinach-like leafy vegetables, drink plenty of water, and ladyfinger okra, tomatoes in any form, even in salad, even in sauce.
They have to avoid it.
Avoid it.
Okay.
And seeds.
Tomatoes even.
Yes, tomatoes.
There's a very common food.
All these things are rich in salads, which we are eating it on a daily basis.
Yeah.
Cabbage we are eating, spinach and spinach-like leafy vegetables we are eating,
Yeah.
tomatoes in any form we are eating,
Yeah.
okra, and seeds which are edible seeds like guava seeds and pomegranate seeds. These are rich in oxalate.
Okay.
So we have to avoid those.
They have to be avoided. And if there's maybe another common type of stone, which would that be?
Like uric acid stones. Okay.
And what diet should somebody have if they are having uric acid stones?
Yes, if somebody is having a uric acid stones either by the stone test or by the blood test of the uric acid, then they have to avoid mutton, red meat, mutton, beef, chocolate cake, coffee cake, internal organs like liver, brain, kidney, etc., and nuts.
It sounds like very sad to have kidney stones, because there's so many great things you can't eat.
Yes, but issue is that if you will not eat those things, then you will not come back to the doctor. Otherwise, it's a recurrent disease. You will continuously following your doctor. And it runs in families as well. So once you have the stone, your whole family is our patient.
Oh, wow. And is it like a black and white thing? It's like you just don't eat any tomatoes anymore, or should you just limit the amount?
Oh, well, ideally you should avoid these things for 1 to 2 months, and then one thing out of these things you can eat. But again, uric acid runs in families as well. So even if you will do this dietary advice, still your uric acid is on higher side, then you have to be on uric acid medications.
So basically, somebody who has a propensity to develop uric acid stones should maybe become a vegetarian.
Vegetarian, not really. You can eat chicken, you can eat fish.
And what can you tell us about the treatment options, apart from, because you said we remove the stone? How do we remove the stone?
Well, stone treatment depends upon size of the stone and site of the stone, where it is and how big is the stone. So, for example, if you are talking about the kidney stones, if it is small, less than 5 millimeter in size, no need for any treatment. If it is solitary, no need for any treatment. Even if they are multiple, no need of any treatment. Give them some medications for the stone dissolution, so that the stone can dissolve, and observe those stones. Okay, and if the stone sizes are getting bigger, then you have to treat those stones. For example, if the stone size is more than 5 millimeter, and then between 5 to 1 millimeter, 1 centimeter, then we can do the shockwave treatment as well. Okay, and if the size is above 1 to 1.5 centimeter, then we can remove it by flexible ureteroscopy, which is the treatment of choice, which is called the retrograde intrarenal surgery as well.
And that means the shock wave, that sounds a little bit scary. Shocking, waving, what's happening there?
Well, it is basically an electromagnetic waves. Okay, it's not requiring any anesthesia. It's a 35-40 minutes procedure. Our machine is best in town. Okay,
Wow.
so there are very less side effects. As I have told you that our machine is excellent machine. It is done under local anesthesia, just with one painkiller. Okay. But the other machines, the other generations, the first generation machines are very painful. They required anesthesia.
Oh, okay. Wow. Yeah. And you also spoke about ureteroscopy, which means that you actually go with a tool inside in order to remove the stone.
Yeah, we have special instruments in which we are going inside into the urethra and going to the ureter and going to the kidney. Wherever there is a stone, we are following that stone, and then we are fragmenting that stone with the laser. Okay, and we are removing it by basketing it.
And what general advice would you give to the population about kidney stones in terms of prevention and diet? I mean, it's obvious that everybody needs to drink enough water in the hot areas. Is there anything else that can prevent or make it less, or make it manageable, that you can say as a general advice?
See, if you have a family history of stone disease, or if you have formed the stone before in your life, once in life, then you have to screen at least once a year. Okay,
Okay.
for the stone, because
Yeah.
stone disease is a recurrent disease.
Yes.
It is one of the common reason of kidney failure.
Yeah.
Okay, after the blood pressure and sugar, diabetes. And if somebody is not having any stone disease before, then whenever he has any kind of acute attack or any reason, if they have done any ultrasound and if they have found out that they have stone, then at least they have to come to the urologist to take a proper advice.
Okay, that's wonderful.
Yeah.
Dr. Aatif, it's been so interesting, and you've taught us so much about kidney stones. I'm really thankful that you made some time for us.
Most welcome. Thank you.
Thank you, Doctor.
Thank you.